lives in Canada and is a nurse. So we're excited to hear her story. And it's called Comfortably Chronic.
Hi, can you hear me? Hi, I'm Kathleen. I'm from British Columbia, Canada, and I'm an adult living with cystinosis. I'm also a university graduate and a registered nurse working in the neonatal intensive care unit, or NICU. I live independently and I'm blessed to be in a loving, supportive relationship. But the life I live now didn't always seem super attainable. When I was diagnosed in 2001 at 12 months of age, my parents had no idea how cystinosis would affect my future. When I was initially hospitalized with failure to thrive, one of the first tests back showed phosphate in my urine. My mom, being a physician herself, researched phosphate in urine in children at our local hospital's library. Cystinosis was a result. Everything fit perfectly, and she immediately knew. So she was actually the first person to consider cystinosis as a possible diagnosis. Unfortunately, the library book she referenced was outdated. Its stated life expectancy was 8 to 10 years. My parents were absolutely distraught. We were quickly transferred to BC Children's Hospital, which is about 4 hours away from where we live. There, my family would learn that this low life expectancy had improved, but our lives would still change dramatically. Around-the-clock meds, 24/7 tube feeds, endless vomiting. I'm sure this sounds familiar to many people in the room. And there were still many unknowns on the horizon. As I grew up, I lagged behind in a lot of things. I was always one step behind my peers, sometimes 2 or 3. I struggled with missing school and social events as a result of countless hospitalizations or appointments. Constant nausea, complications, and new challenges to be faced often made meeting milestones on time more than difficult. I struggled to read. I remember just looking at pictures in books, pretending I knew the words. My dad and I would sit at the kitchen table for hours trying to memorize the weekly spelling test to very little benefit. My math was at times grades below where it should be. Physically, I was often frustrated by my body and how others perceived it. I couldn't effectively jump for many years. My feet just absolutely refused to leave the ground. Most of my caloric intake came from tube feeds until I was 10. I still required a G-tube until I was 13. I was tiny and often mistaken for my younger sister's younger sister. That's us there, the smaller one. I didn't learn to ride a bike until I was 12. Prior to that, I just didn't have the strength to push the pedals fast enough to stay upright. My first solo ride brought tears to my dad's eyes. But eventually, with most of my milestones, I did get there. I just needed time, and it had to be at my own pace when I was ready. I was a classic late bloomer. I went from struggling someone who struggled to read to someone who devours books at an alarming rate. I admit I still can't spell to save my life, but my math improved. And although it was never my best subject, I caught up and I did get it done. In high school, I became very academically focused, doing everything in my power to stay on track when my health threw curveballs at me. I would eventually be offered university scholarships. Although I still sometimes have to adapt things to accommodate my physical needs, I did learn to eat orally, to jump and leave the ground, and to ride a bike. It just had to be on my own schedule, without regard for anyone else's. Later, when I was 17 and 2 years post-kidney transplant, an opportunity arose for grade 12 students in my high school to volunteer in Guatemala. The goal was to fundraise to buy and install safe, efficient stoves for needy families to replace old hazardous ones. But my post-transplant journey had not been super smooth. I struggled with complications and hospitalizations that took a great toll on my health, requiring adjustments of therapies, reintroduction of tube feeds. But I knew in my heart I needed to go on this trip. My family and high school counselor were reluctant. Guatemala is not known for its fantastic healthcare or safe drinking water. But being a notoriously stubborn, tenacious person, I took it upon myself to write a letter, a portion of which I'll read to you now. I would argue that the point of having a kidney transplant is to be able to go out into the world and live your life, to be able to live it to its fullest, not live a half-life and be stuck in a bubble at home. So much of living is about experiences. What happens to you, what you get to do, and how those events affect you. An experience like the kind being offered at Sahali, which was my high school, would truly be living your life to get the most out of it. And that's exactly what I want to do, and what having a kidney transplant is supposed to be about. It's supposed to give you your life back, not inhibit you from taking part in something like this trip. And miraculously, largely due to this letter, I was given approval with certain conditions, and I went on the trip. I want to stress how important this experience was for me. Growing up with cystinosis, having a kidney transplant, as a patient, very few things are often in your control. You can be given amazing, positive life experiences, but they can also be taken away. If cystinosis or having a transplant had stopped me from going to Guatemala, I would have been devastated. Volunteering in Guatemala tested and confirmed my independence, my resilience, my tenacity and character, and assured me that I could have these type of life experiences like any other person. On top of that, it was a lot of fun. I can't describe to you how important this was. It was also in Guatemala that I happened to find out I was accepted into the Bachelor of Science in Nursing program at the University of British Columbia. This was my true goal. I decided I wanted to study nursing when I was 14. At the time, my mom was going through breast cancer and surgeries and chemotherapy. My best friend was being diagnosed with an autoimmune disease, and I was being worked up for kidney transplants. I was experiencing my own healthcare crisis, along with that of some of my closest supports. These crises caused me to clearly recognize more than ever before the incredible role and tremendous impact nurses can play in a person's healthcare journey. Influenced in the most deeply personal way, I decided I wanted to become an RN myself. Nursing school is complex, demanding, and difficult. At times, my personal history compounded the complexities of nursing. At times it still does. Personal emotions and experiences come into play, which can be a hindrance or a help, depending on the circumstances. Sometimes my traumas have felt compounded by those of my patients, or my fight or flight response is activated. Something as simple as the taste of icy water from a styrofoam cup and plastic straw can bring back intense memories. But at the same time, my ability to inform, empathize with, advocate for, relate to, and support my patients and their families is increased because of my own history. During university, I also experienced health complications, such as multiple transplant rejection episodes, kidney transplant. These are both physically draining, but also mentally exhausting. Being away from home and realizing your transplant is not doing as well as it should is devastating and scary. There are many conflicting and isolating emotions at play. But also, for me personally, education has always been a priority for me. The potential impact of these health struggles on my schooling caused me much frustration. I worked incredibly hard to stay current in my classes between medication infusions, admissions, kidney biopsies, and appointments. Graduating on time with my class, despite these challenges, remains a proud achievement of mine. Being a nurse has also made me think deeply about the way we think of illness, and chronic illness specifically. When you first disclose to people that you have a chronic disease, the initial reaction can be one of pity. For me, I have come to believe that pity is disempowering and sometimes patronizing to those with chronic illness. Empathy, however, is incredibly empowering, especially in the rare disease community. Rather than projecting assumptions about someone's life or abilities with the sentiment of, I'm so sorry, your life must be full of suffering, I'm happy I'm not you, I would wish for people to think, wow, your life and difficulties in life are so different than mine. What is that like? And how can I support you in this moment? The implication that somehow a chronic ill life must be inferior or inherently less joyous comparatively to a healthy person is damaging to those living it and just not true. This is not to say that feelings of frustration, anxiousness, or sadness are not common. Believe me, I've been there. But there is more to a chronically ill life than just these emotions. People sometimes have the tendency to forget that. Those of us with chronic diseases can have a life just as complex, beautiful, and rewarding as someone who is healthy. My life has as much purpose, love, joy, and intent as anyone else's. Sometimes it may look different, but the values remain the same. This life is profound, joyous, passionate, and uniquely challenging. It is at times hilarious, motivating, and full of impactful experiences. It's a life I'm currently living. Perfectly imperfect, comfortably chronic life. Thank you.
Ask you some questions. We're going to ask you some questions. Okay, that was incredible. Who has a question? I guess I have one. So your nursing schedule, your regimen, um, how how is your stamina? What would be your schedule? A normal work week. I'm just curious, like, are you 8 hours a day? Are you 4 days a week? Those types of things. And how's your stamina?
So I work 12-hour shifts. I tend to do 2 days, 2 nights, and then about 5 off. Um, it's difficult, I'm not gonna lie, sometimes. I tend to, during my sets, so those 2 days, 2 nights, and then like 1 day of sleeping after that, I basically just work and then sleep and eat. There's not a lot else going on. Um, but I really appreciate having the like 5 days in between. I think that's really helpful. Um, and it's also like I love what I do, which makes a difference. Yeah, I really love the area I'm in. NICU and Peds. Yeah.
That's great. Anybody have a question or comment?
Hey, Kathleen, thanks for sharing. That's great. So the transition from sort of adolescence to becoming an independent person, there are probably a few challenges there, and there are a lot of parents in the room. So I guess, do you have any advice for parents of maybe like teenagers right now who will be going through that here soon?
That's a really hard question, I think. um, I think it probably depends a lot on the situation. I think like I use Guatemala as an example of kind of like my family was really reluctant to let me go. My dad like years ago experienced he got really sick there, so they were reluctant to let me go, like immunocompromised 2 years post transplant. But I think allowing your children to have those freedoms and make their own decisions around that, like any other kid, really is like really important to let them have that gather their own confidence around those type of things too.
Okay, well, that was incredible. Thank you.
Thank you.